Good morning, and thank you for joining us for today's press conference. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today, and we are limited to 1 hour. If there are remaining questions in the queue when we conclude and you feel your question hasn't already been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. Thank you. Thanks again for joining us. We will now begin in just a few moments after we grant recording permissions. I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat and we will take care of that right away. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Terrific. Thank you very much, and good morning. I appreciate everyone joining us today. I'm Dr. Bruce Vanderhoff, the Director of the Ohio Department of Health. The Omicron variant continues to sweep through Ohio, fueling what is nothing short of a tidal wave of COVID-19 cases, unlike anything we've seen over the past 2 years. Our daily COVID-19 case counts remain historically high, averaging well over 17,000 new cases every day. Simply put, community spread is rampant. The Centers for Disease Control and Prevention's benchmark for community spread is the number of cases per 100,000 residents. And this benchmark has proven to be helpful throughout the pandemic in assessing the extent to which the virus is impacting our communities. It's also useful in comparing COVID-19 spread in different communities of different sizes. Now, what's considered high community spread is 100 cases per 100,000 persons. And right now in Ohio, our statewide average is just shy of 2,000 cases per 100,000. 2,000. That's more than 20 times what is considered high. And for context, you might recall that just as recently as July, our figure was as low as 19 cases per 100,000. The numbers clearly demonstrate just how easily Omicron is spreading. This variant is extremely contagious, and cases are skyrocketing as a result. In this Omicron surge, we need to remember that no one is untouchable. Fortunately, for many, it's manifesting as a simple common cold. And this is especially true for those who get symptoms despite being vaccinated. But don't underestimate this variant. Hospitalizations across Ohio have shattered records this month. 2 years into the COVID-19 pandemic, Ohio has surpassed 100,000 total coronavirus hospitalizations, and we passed that mark earlier this week. When it comes to hospitalizations, there is a widening gap between the vaccinated and the unvaccinated. These more severe hospital cases are still mostly among the unvaccinated. And with roughly 30% of Ohioans still unvaccinated, this is a very serious concern. Our hospitals are swamped, and hospitals in all corners of the state have had to take extraordinary measures, including postponing elective surgeries and other medical procedures. The Cleveland Clinic will be receiving federal assistance from a team of 20 U.S. Air Force medical professionals. That team will include nurses, physicians, and respiratory therapists. The clinic asked us for this support as hospitalizations were peaking, and the Ohio Department of Health, in coordination with the Ohio Department of Public Safety and the Ohio Emergency Management Agency, worked with the Federal Emergency Management Agency, known as FEMA, to seek assistance. The team will begin working next week at the main campus. Past deployments like this have lasted about 1 or 2 months. The Cleveland Clinic shares that this support will help them open closed beds and be able to accept more transfers. This is yet another example of how Ohio has taken statewide action to assist with coordination among hospitals and to decompress our hospitals. Adding more staff will benefit the entire region and will supplement the efforts of the National Guard and the existing staff in maintaining standards of care throughout this COVID surge. Now, in addition to the severe stress on our hospital systems, Ohio is facing an unprecedented demand for testing as national testing supplies are drained. Ohio is one of the first states to prioritize widespread distribution of free rapid testing kits and has purchased and distributed about 5.6 million free testing kits, 1.4 million in December alone. We provide these tests to schools, colleges, and universities that request them, as well as to local health departments and libraries for distribution in communities to anyone who might need them. This month, Ohio ordered 1.2 million proctored test kits. Those are the ones that use a telehealth session to guide users through the testing. But only a fraction of those tests have arrived and are being distributed due to a shipping delay. As a result, Ohio is prioritizing the state's supply to first support testing for our K-12 schools and colleges and universities. COVID-19 tests are essential to helping ensure in-person learning and ensuring that that continues for students and their teachers. Because schools are experiencing significant new demand for tests as COVID-19 cases surge, the state is temporarily pausing shipments to our other community partners, including libraries and local health departments, until inventory and the supply chain have stabilized. Now, while testing supply chains are challenged, it's important to note that there are many testing opportunities available in Ohio beyond state-provided rapid tests. Over-the-counter rapid testing kits can still be purchased at many locations, including pharmacies and grocery stores. Testing is also available at many urgent care locations, community health centers, retail locations, and pop-up sites. And of course, we continue taking decisive actions to help expand testing availability statewide with the help of the National Guard. This week, Governor DeWine announced additional testing locations that will receive Ohio National Guard support. This is part of continued efforts to alleviate our stressed hospitals and hospital systems and to bolster our overall provision of testing for all Ohioans. This effort started last month with the Walker Center in Cleveland to support Cleveland area hospitals as they contended with unprecedented demands on both testing and patient care. Since the launch of the Walker Testing Center, more than 22,000 people have been tested, averaging more than 1,100 people every day. That's remarkable. Now, 15 testing locations are receiving similar support through the Guard that's diverting testing from overwhelmed emergency departments and expanding the capacity of our testing centers, in some cases, doubling or tripling that capacity. Today, we're joined by Major General John Harris with the Ohio National Guard. Major General Harris is here to provide an update on the steps the Guard is taking to offer Ohioans expanded testing options and to offer a degree of relief to some of our hardest hit hospitals. Major General Harris, can you tell us a little bit more about how you manage and support so many Guard members being deployed to Ohio's hospitals?
Thank you, Dr. Vanderhoff. And as always, thank you and your colleagues for the great work you're doing during this pandemic. We currently have close to 2,000 Guard members deployed across the state in various hospitals at 60 locations, about 48 hospitals and 12 individual freestanding testing sites, in addition to three testing sites that we have going on internal to the hospitals. As you can imagine, maintaining command and control over such a large footprint can be very difficult. One of the great things about the National Guard, quite frankly, is that we are configured for disasters and emergency response. And this in fact, is that kind of disaster. So when Governor DeWine called me initially and said, we're going to deploy the Guard to help with the strain in these hospitals, we were able to very quickly overlay a typical military template over top of this disaster. So we configure in 10-person teams. Those 10-person teams have organic leadership, whether they're medical or the non-medical teams that are doing the support functions inside the hospitals. We can take that 10-person team and overlay it over any type of mission. We take those teams that are disciplined and they're trusting and they have that organic cohesiveness, and we can very easily lift and shift teams of 10 basically to any location and put them on any type of mission. As long as they have the appropriate training, we know they're going to be successful. So in addition to standing up regional headquarters and a joint task force headquarters at the brigade level, we've created those 10-person teams, and it's proven very effective. We've also deployed our planning teams, as you know, Dr. Vanderhoff, to work every day with the Department of Health and Ohio Hospital Association, with your team, to forecast where this disease is going. And we can very easily lift those 10-person teams and configure them as building blocks to meet the mission anywhere in the state. And over the next few weeks, as we stand up additional testing sites, but also as we expand our footprint inside the hospitals, we can do that very easily and very quickly based on that structure. So to meet Governor DeWine's intent, which is being quick to need, being there quickly, and being able to configure ourselves to be agile enough to follow this disease and to meet the requirement wherever it falls. The National Guard's a perfect fit for that. And we continue to build out our capabilities to ensure that we have the proper support for our soldiers and airmen. So we have chaplains and counselors on our staff that we can deploy with these teams to coordinate with the ministry teams in the hospitals to make sure that our soldiers and airmen have the proper support there for their mental health in these stressful situations, just like the hospital staff. So the versatility that comes from the structure of the military, along with the very clear intent that Governor DeWine has given us, has made this mission not easy for us, but certainly one that we can sustain.
Thank you, General. You know, I've been particularly impressed by the Guard's ability to step in at our testing sites and really drive a dramatic increase in daily testing output. Can you tell us a little bit more about the work that Guard does at those testing sites and how they're able to support those increases in test throughput?
Well, those 10-person teams with the organic leadership, we overlay those over the testing sites, and they roll in and they basically do whatever's needed at the site to help increase throughput. So the primary thing that we find them doing is swabbing, helping with the swabbing, collecting those samples, but they do everything from traffic control to administrative tasks, registration, checking folks in, checking them out, and that sort of thing, and just helping with general logistics around the site also. And we can scale that. So if a site has throughput that exceeds capability, we can simply lay another team over top of that site. And we find ourselves doing that with your planning teams pretty often. Dr. Vanderhoff is and we will here in the near future, is just looking at where that demand exceeds capacity, and we will be lifting and shifting resources to meet that demand.
Well, thank you so much, General. Thank you and all the Guard members for your service. I know on behalf of all Ohioans, we're immensely grateful, and the impact that you and your service members are having is very impressive. So many thanks.
Thank you, sir.
Next, we're joined by Dr. Daniel Bachman, who's an emergency physician and director of emergency preparedness at the Ohio State University Wexner Medical Center. And he's here today to talk a little bit about Omicron's impact on our hospital emergency rooms. Dr. Bachman, Ohio State recently opened a COVID-19 testing center that's supported by the Guard. Can you share a little bit more about how this testing site is actually helping to decompress the emergency room and help the emergency room cope with this unprecedented surge?
Thanks for having me on, Dr. Vanderhoff, and I'd be happy to share our experience. As Major General Harris has outlined, there's a number of different tasks and jobs that the National Guard is playing a role. So at our testing site, we have a drive-through, high volume, high efficiency site, and they're filling some of the jobs such as directing traffic, doing some of the actual swabbing, some of the logistics work. And what that does is it allows that 1,000 patients or plus per day that we would otherwise have to absorb somewhere else in our system to be all concentrated at that site. We do still have testing capability in our hospitals and emergency departments and clinics and urgent cares, but with the volume that we're seeing, there's no way that we would be able to handle that in those places alone. So that testing site has really been a pressure relief valve for the super high volumes that we've been seeing. The one thing that I would add that Major General Harris didn't specifically allude to in terms of what his members and what the National Guard are doing is the morale boost and the positive impact that they have on our staff and on everyone that they're interacting with. I've heard multiple stories from my staff, from our testing site. We have National Guard working in our hospital also, and it's just really a morale boost to have them there. As everyone knows, this has been a long pandemic that we've been dealing with, and so that impact can't be understated, and we really appreciate that.
Thanks. Dr. Bachman, tell us a little bit more about life in your emergency room. What are some of the ways that you and your team are responding to cope with this rapid rise in people seeking your medical care?
So yeah, this rise in cases has meant an increase in our volume through the emergency department, as well as an increase in volume of patients that require hospitalization. Most of the patients who require hospitalization are the unvaccinated patients. But that impact is really being felt by all patients, because whether you're coming to the hospital with COVID or you're coming to the hospital with some other medical issue, the constraint on our capacity, the historic volumes that we're seeing, is being felt by everyone right now. And I can give you an example of that. This morning in my county, we had well over 100 patients waiting to be hospitalized, and throughout all of the healthcare systems and hospitals in my county, we had less than 10 beds to fit those patients. So it creates a backlog. The National Guard, again, as I mentioned, has been useful in the hospital also, besides with the testing, and that has provided us some increased capacity to absorb some of this volume. We are also using our staff in creative ways to provide, again, higher capacity both in the emergency department and in the inpatient setting. From a testing standpoint, we are at a point that patients won't necessarily be tested if they come to the emergency department and are low acuity, meaning they otherwise are pretty well appearing and don't have other illnesses that would place them at high risk for complications from COVID. In those situations, patients may not receive a test, even if they come to the emergency department. They'll still be evaluated, but that testing, creates adds to some of the inefficiency, and so that's a step that many healthcare systems have taken in response to the high volumes that we're seeing.
Thank you, Dr. Bachman. Just one final question, and that is, what would you, in light of all this, ask members of the community to do to help hospitals cope with the volume that you're seeing?
Well, I think there's two things from that standpoint. The first one is one that I alluded to, which is vaccination. It is not too late to be vaccinated, and the impact of being vaccinated is real. It doesn't mean that you won't necessarily get infected with COVID at some point, but what it does mean is that your chance of needing to be hospitalized and your chance of having serious effects from a COVID infection are much, much, much lower if you're vaccinated. So again, I can't stress the importance of vaccination enough. I think the other thing that we're seeing, especially right now, is the high volume and the decision to seek care and/or testing at all. If you have COVID symptoms, but you otherwise feel well, you may not need to be evaluated in a healthcare setting. You can start with simple measures, such as doing a test at home if you have a home test available, going to a testing site. Again, there are testing sites that are sponsored by public health departments, by healthcare systems. There are commercial testing sites at drugstores, and you can get a test and answer the question, do you have COVID in that manner? And if you determine that you have need for emergent care over and above your question of, do I have COVID, then it's still appropriate to come to the emergency department. But that's not necessarily something that most or all of patients who have COVID symptoms really need to do. The last thing that I would mention is call your primary care physician. That phone call to answer a few questions, if you're not sure which of those routes that you should go, can be a helpful thing.
Thank you so much. Next, I'm joined by Dr. Jennifer Wall-Forrester, Associate Chief Medical Officer and an infectious disease physician at UC Health in Cincinnati. Dr. Forrester, so we've been talking about the Omicron wave and the impact it's having on all parts of Ohio, which of course is including Southwest Ohio. And my question relates to the fact that many more people with Omicron are reporting more cold-like symptoms than we heard with previous variants of the virus. And that might mistakenly cause some people to dismiss Omicron and really not worry about it. And yet at the same time, we're seeing very high numbers of hospitalizations, an all-time high here in Ohio. Can you describe a little bit more about the patients that you're seeing get hospitalized during this Omicron surge?
Yeah, so you're right. Most patients do experience kind of the upper respiratory symptoms with Omicron, a little different than prior variants. I've actually seen patients who perhaps maybe have a little bit more flu-like symptoms than even just a regular cold. So kind of some bad muscle aches. Most of them will stay out of the hospital. But because of the sheer number of infections, as you've said, our hospitalizations are skyrocketing. It's just simple statistics, right? Even if 15% are hospitalized, 50% of record high numbers are record high admissions. We are seeing higher pediatric admissions this time around as well. Those who are admitted actually have similar symptoms to patients admitted with other variants, really related mostly to problems breathing. While we are seeing more people hospitalized, luckily there hasn't been as drastic an increase in those that end up in our ICUs, especially when they're vaccinated. But we are seeing similar numbers of patients in our ICUs as we did in the surge last year, and we have less staff. So it feels like more patients. By far, the patients in our ICUs with COVID are unvaccinated or severely immunocompromised, for whom really vaccines haven't been particularly effective.
So how is your hospital coping with this surge in cases, this really unprecedented demand on hospital resources?
Yeah, well, first I'll say healthcare workers are not immune from getting sick from COVID-19. And so we are seeing more staff than ever off of work right now because they're ill. For those of us that are left, to be honest, we're exhausted and trying to keep up with the additional stress on our healthcare system with minimal resources. Hospitals in our area are doing some of the same things that Dr. Bachman mentioned. All of our healthcare services are stretched. Some are hospitals in this area, some of the procedures and surgeries that are elective are being delayed. We are desperately trying to balance getting our staff back to work as early as possible based on CDC guidance, but in a way that allows them time to get better and keep other employees and patients safe. We luckily actually here in Cincinnati have had our first deployment of Ohio National Guard troops, again, echoing the relief that brings to our healthcare system. They're helping with the mass testing site here in our city as well. It's my understanding that as the northern part of the state maybe starts to see some plateauing, that we may get more National Guard to help in our hospitals as well, as we're still on the rise here. This will definitely be a welcome sight. We're really just doing the best, struggling for sure, but getting through this, I hate to say another unprecedented time, but that's what it is.
Thank you. And I'm going to ask you then the same question I concluded with Dr. Bachman, and that is, as an infectious disease doc, what would you recommend Ohioans and your patients do to protect themselves, their loved ones, and their communities at this time?
Everyone just needs to do their part. You had mentioned how important in-school learning is for kids. I have 3 kids of my own, so I 100% agree with you. And here in Cincinnati, besides the increase in hospitalization, some of our schools are being forced to go remote again because many kids and teachers are sick. And so again, that's something that is important to many people as well, in addition to the hospitalizations. None of us want to see that again. And I realize I probably sound like a broken record, but really it's because we do know some things that work. In order to protect yourself and others, wear a mask, maintain social distancing if you can, stay home if you're sick. unless you're sick enough to need hospitalization. Wash your hands and get vaccinated and get your booster if you're eligible. The CDC just opened up booster eligibility for even the middle-aged children. So we're really on a team here trying to combat this virus, and everyone on a team needs to do their part. So please help.
Thank you so much, Dr. Forrester. Well, many people are wondering if maybe we're reaching the peak, particularly up in the northern part of the state. And while we see hopeful signs, the answer right now is we just don't know. We're continuing to watch the numbers and are encouraged to see some indications of a start to a downturn in some of the areas that were first hit the hardest. But we're very far from being out of the woods. Other parts of the state are now experiencing also unprecedented cases and hospitalizations. If we've learned one thing about COVID, it's that it is extraordinarily unpredictable and things can change dramatically and quickly. The bottom line is this: COVID-19 is not going away, and Omicron is not just a little cold for everyone. Lives are still at risk, and lives, sadly, are still being lost. Indeed, we've had to say heartbreaking goodbyes to more than 30,000 Ohioans because of COVID-19. These are our mothers and fathers, grandparents, sometimes siblings and children, not to mention friends and coworkers. So now more than ever is the time to take extra steps to ensure that you're protected, that your loved ones are protected. And if you're vaccinated, know that you might get infected, but the odds are against you getting severe illness. On the other hand, if you're not vaccinated, you're taking a big gamble on your own health and wellness. More than 6.4 million Ohioans are now fully vaccinated, and more than 2.9 million are boosted. But millions of Ohioans still are not. If you're not vaccinated, please talk to your healthcare provider and get the facts. And then please consider getting vaccinated. The most important thing we can do is to take the steps that will protect ourselves, our loved ones, and our communities at this time of very high spread. Right now, we also have to remember that we have to ensure our hospitals remain in a position to meet the critical healthcare needs of all Ohioans, not just those with COVID. How can we help our hospitals? Well, we've heard a lot from our guests so far, but another consideration is donating blood. Blood donations have been low throughout the pandemic, but now as hospitals are particularly challenged, many of the areas of our state are facing critical needs. Community blood donations are needed now more than ever. And I'd encourage you to visit givingblood.org to find out how to donate near you. Next, let's remember to do everything we can, as Dr. Forrester said, to stay healthy and reduce community spread. Layered prevention strategies will increase our odds of avoiding severe illness. The winning combination is vaccination and timely boosters, along with testing if possible, staying home if you feel even the least bit sick, masking indoors, especially in a crowded environment, proper ventilation, and regular hand washing. These strategies can help prevent the spread of COVID-19 as well as flu and other illnesses this winter. Now, if you have cold-like symptoms, but you're just not sure if it's COVID, I'd ask you to make the assumption that it is. Mask up, isolate yourself to further reduce the spread of COVID in the community. And remember, even with few or no symptoms, you can pass COVID-19 along to someone else who might end up in the hospital or worse. So don't take chances. Let's stay vigilant. Together is the only way that we can help reduce the spread of COVID-19. Thank you. And now, Michelle, I think we can jump to questions.
Thank you, Dr. Vanderhoff. Our first question is from Dan DeRose with WOIO.
Good afternoon, everyone. Thanks for taking the time for us reporters. It's truly a benefit. Dr. Vanderhoff, I'd like you to address this new step. President Biden just in the last hour announcing sending out military medical personnel, as you addressed, 20 into the Cleveland Clinic. What does that say about where we are, that just six states are getting this help that does include Ohio? And is 20 enough for a place like Cleveland Clinic?
Yeah, thank you so much. Well, I think that what we see in the president's action is a clear validation of the fact that Ohio has been on the front end of this surge, along with a number of other states, and that additional support and help is needed. And of course, as I shared, we worked very closely with the emergency management authorities here in the state and the Cleveland Clinic and others to complete that request, which made it possible for us to receive that additional help. But Governor DeWine really took decisive and substantial action in this direction a number of weeks ago in the move to deploy the Guard. So we've already been on this footing of responding in a decisive way to augment the human resources available to our hospitals, as they have been working collaboratively and working so well and so professionally to respond to this unprecedented crisis. You know, one of the recognitions that I think needs to be underlined in all of this is recognition of our tireless healthcare heroes, the people who work in our hospitals, whether they be nurses or respiratory therapists, pharmacists, doctors, or the many people who help the operations of the hospital function effectively, have just worked tirelessly over the course of many, many, many months, and have once again stepped up and are taking on extra hours and extra duties and responsibilities. And we can't, as Ohioans, really thank them enough. So when you encounter a healthcare professional, they're tired and yet they remain committed, thank them, give them your vote of confidence.
Our next question is from Joe Ingles with Ohio Public Radio and Television.
Hello, doctors. Thank you for doing this. I appreciate it. I want to ask you a question about the new priorities. Doctors have explained that antigen tests that will be used in the schools don't often show Omicron immediately. In fact, a recent study shows it can take up to 3 days for the rapid test to show COVID. And according to the Ohio Department of Education's website on January 6th, less than half of the state school districts require all of their students to wear masks in schools. So wouldn't the better choice be to provide high quality masks to all of Ohio's schools so unmasked kids can not spread the virus around, and keep those antigen tests available for the larger community where people can actually test over time?
Well, thank you so much for that question. And I'll start off fielding. There are a number of layers to your question. First of all, of course, we have continued throughout the pandemic to strongly advocate for masking in our schools. There's a tremendous now amount of data and support scientifically for the benefit that the masks provide in the battle against COVID-19 and as a part of our efforts to keep kids safely in our schools. So we've continued to encourage that. And of course, we have continued to support schools with the provision of very large numbers of masks throughout the course of the pandemic. In terms of the testing availability for our schools, as we've said so far today a number of times, layered strategies are the best strategy. You know, a mask is not perfect. A test is often not perfect. But when we apply the tools that we have and we apply them together, we often are able to achieve a more substantial result than if we were doing it with those things in isolation. The good news is that the tests that we have, the rapid tests that we have, do in fact detect the Omicron variant, even if there may be, in some circumstances, a little delay in the time frame for that detection to occur. And by the way, that is still under careful scientific scrutiny. So we don't yet fully understand that situation. What we do know is the tests are still detecting the Omicron variant. And I think that's an important thing for us to recognize. Our approach has been to take a very layered approach and to use all the tools that are handed. And we'd encourage school districts around the state at this time with a focus on keeping our kids in in-person learning to use all the tools that are available.
Our next question is from Alan Henry with NBC4.
Thank you so much for your time. We're just curious, we're hearing a lot from our viewers about test kits being very difficult to find. So you kind of touched on this earlier, but what would you want Ohioans to know who are out there looking for a way to get tested, especially with those kits, and try to get that test day of so they can go back to work or back to school?
Yes, well, thank you for that question. Well, in addition to what I shared already, let's remember that Ohio was one of the very first states to prioritize widespread distribution of free rapid test kits. And as I mentioned, in the last year, we've distributed 5.2 million of those. Demand, as I've shared, is very high now. It's been high throughout the pandemic, but particularly so now. As a state, we've been working in close partnership with local testing partners that have included local health departments, public libraries, schools, community health centers, all with an eye towards being able to distribute in as an accessible a way these over-the-counter self-administered tests. But that supply chain nationally is being challenged. But in addition to those tests, I don't want us to lose sight of the fact that we have many, many other efforts in play. Over-the-counter rapid testing kits can still be purchased at many locations statewide that include pharmacies and grocery stores. And we're seeing incredibly high numbers of Ohioans who are getting tested to the tune of 60,000 plus every day just this past week. And these tests are being performed for a wide range of reasons, but they are, in fact, being performed. And I think we feel very good about that. Very important part of that, of course, has been the effort that we've undertaken with the Ohio National Guard. And we've seen the impact of the Guard's work and talked a little bit about that here today. So I'll open to my guests. I don't know if there's anything that they would like to add to the question about testing and testing availability.
I'll just add that I agree some of these mass tests the National Guard have been incredibly helpful in Cincinnati. Certainly, I don't think you can find a rapid antigen test on shelves in any pharmacy, or I know the library is out of them all the time now. I would say I know that may be difficult for maybe people in the more rural areas. I know the mass testing areas are generally in the urban areas, but touching base with your healthcare provider may have a way to get you tested at their location, or have connections otherwise too. Again, trying to keep people out of the emergency room, as Dr. Bachman mentioned, but oftentimes we have ways to get you tested too. They may not be as quick as the antigen test, but again, a piece of information to get you the answer that you need.
And just for clarification, I do want to make sure that people know that we have a large number now of sites that we're supporting testing with the help of the Guard. You, again, I think, can go to health providers in your area to learn more about some of that. We also have information that's posted on our website, coronavirus.ohio.gov, and there's an Ohio National Guard report that is listed there. So many sites now across the state are being supported, including ones in communities like Zanesville, the areas like Chillicothe. So we are aiming to deploy these capabilities as broadly in the state as possible.
Yeah, I think Dr. Vanderhoff and Dr. Forrester really covered it all. I don't have anything to add to that.
Thank you, doctors. Our next question is from Sarah Shookman with WKYC.
Good morning, Dr. Vanderhoff. A few follow-ups about Cleveland Clinic's federal assistance. How are these medical military teams different than the National Guard members we have already deployed? Are these jobs the National Guard can't fill either because of training or vaccination status or because they're needed elsewhere? Or is it related to the length of the deployment? And secondly, the White House also said it expects to see more of these military deployments. Would you expect other hospitals or other parts of the state to receive federal help?
Well, I can answer that question to a degree, but I would defer to military experts. And I don't know that the general is actually able to still be with us at this point in terms of some of the greater details. When we completed this application in partnership with local authorities and the Cleveland Clinic, it was with an objective of adding additional resources to those that were already being deployed or provided from within the state. And so these, I think, really can be looked upon as incremental healthcare human resources that are being deployed, vital resources to augment our state's ability to respond. They are not viewed as replacements for those resources, but an addition to the resources that we're providing.
Our next question is from Maya Belay with Fox 8.
Hi, doctor. Thanks for taking this question. I have a follow-up to the one that was just asked. I'm wondering just the selection process for which hospital was chosen. Earlier, you mentioned the Cleveland Clinic was selected for this federal aid because they requested additional. Are we to assume that no other hospitals reached out to you for this specific aid? And what would the timeline be for other hospitals receiving a similar type of assistance?
Well, thank you for that question. We have made the hospitals across the state aware of the potential availability of this kind of assistance and what the federal application process is, and have committed to working with hospitals that believe themselves to be good candidates to complete the application and have our support behind the application. There are other hospitals with whom we have been working. I don't know the state of that application process as we're speaking now, but the decision at the federal level is a decision at the federal level and not one that I can speak to.
Our next question is from John London with WLWT News 5.
Thank you, and I'm interested in hearing from Dr. Forrester about Cincinnati, just made mandatory for all city workers to mask. I know the city's reluctant to issue a public mask mandate, but as you know, health officials yesterday were asking people who pack bars and go to the big Bengals playoff game on Saturday to mask. So I'm as a physician, would a public mandate to mask be counterproductive, do you think? And is persuasion too soft a step at this point?
Gosh, I wish I had the answer to that question. I do I do believe that we should be out there masking. I'll be honest with you. I don't know that I've gone into a public area without a mask since this all began. And certainly at these areas, at these playoff games, Who Day, that where you're going to be in so close contact with a lot of people and hopefully, yelling and cheering. I think we've seen in the past, backlash from mandates. I really believe that, again, if we can all just do our parts, I wish I had the answer to appropriate and the best way to persuade everyone. But remember, every time someone sees, I hope that every time someone sees me wearing a mask and feeling comfortable with it, or my children wearing a mask and feeling comfortable with it, and, still, maybe being outside and smiling and, talking to people about why I wear a mask or whatnot, that hopefully that moves on and maybe makes another person feel more comfortable as well. And I think that, again, leaders in different areas wearing masks is often people take that and say, oh, okay, they did it. I should do it too. So again, the more people that are out there wearing masks, I think the more comfortable it is for everyone to do the right thing.
Can I add something to Dr. Forrester's comments?
Yes, please.
Thanks. So the one additional benefit that I would, I agree with everything that Dr. Forrester said in terms of benefits of masking, but I would add this additional one, which is we're seeing influenza currently, and a mask helps for all respiratory viruses, not just the COVID-19 respiratory virus. Influenza is also a respiratory virus, and there's really a laundry list of other ones. So that's one more additional benefit that we can add to masking.
And influenza is out there this year. We didn't see much of it last year, likely because we were all separated quite a bit, and masking was a little bit more prominent. But there have been schools closed here in Cincinnati. I think I mentioned this before, because of influenza as well.
Our next question is from Larry Seward with WCPO.
Good morning, doctors. As more people consider the quality of the masks that they're using, I wonder, in hospitals, is there any concern preparation for supply chain strain on the PPE that you all use, the N95 masks? And specific to Dr. Forrester, where do you see the National Guard members deployed, helping first and best in your hospital system?
Okay, well, first, in terms of the masking question, health leaders all across the state have been very mindful of the importance of masking and preparation for having adequate mask availability. And that's included an ongoing partnership between the Ohio Department of Health and our hospitals, both pediatric and adult. And as I've shared before, we in fact talk multiple times a week and have done so throughout the pandemic. So our supplies of masks for use in medical settings right now is adequate. We are not facing right now challenges related to supplies. We are not facing challenges related to physical infrastructure. What we're facing are challenges related to staffing, and we've outlined those before, so I won't go into those in depth. But rest assured, when you go to a healthcare facility, you can be very confident that they are applying the guidance that has been provided by national health experts and are required by organizations like the Centers for Disease Control, and that they have the supplies necessary to ensure that can continue even as we're facing these unprecedented numbers of patients. So that would be my answer there. Let me pause and segue to Dr. Forrester, because she's a hospital-based infectious disease doctor, and I think can underline some of this and the confidence I think that the public can have when they go into a hospital. Dr. Forrester?
Yeah, I'm going to send a shout out to all the supply chain people who, again, a year and a half, 2 years ago, were very, very concerned about the supply of particularly N95 masks. and we made our way through that. But completely agree with Dr. Vanderhoff. They have done a fantastic job of, again, throughout the state and even locally and regionally, of making sure that our healthcare workers are protected appropriately. And, we have learned over time and have, in case that would ever happen again, which again, I am assured by our supply chain group that we are in good places right now, which is, again, I have full confidence that we are not going to end up in the kind of worried phase that we were, almost 2 years ago. Yeah, I fully agree with that.
In terms of the question regarding the Guard, I can answer that from the perspective of being the director of the Department of Health. And unfortunately, Major General Harris is no longer, I believe, able to be with us on this call. But let me share with you again the information that I know from my perspective. Over the course of the past weeks, Governor DeWine has now announced waves of Ohio National Guard activations, and these have been designed specifically to provide support, both clinical and non-clinical, to our hospitals in a manner that allows them to face these growing clinical demands, and to do so in an adaptable way, and in a way that through continued conversation with hospitals across the state to assure that the Guard are deployed where they're needed most in the state. So our response, I think, has been extremely robust. And the Ohio Department of Health has been working closely in turn with the Guard and the Ohio Hospital Association and the hospital zone leaders to assure that we're identifying where those sites of greatest need are. And these decisions are based on factors that include case levels, emergency department strain, hospital capacity, and a whole variety of other measures that help us understand where the impact can be the greatest. So, I think that we should feel very proud as Ohioans that, as of yesterday, the total Guard deployment of members who are working with Ohio's healthcare systems was now at about 2,300 members. And that's a very substantial response, especially in comparison to, while we're grateful for it, the smaller 20-person deployment that we referenced earlier coming through the national FEMA deployment. Again, very helpful. But let's remember the context of the much larger Guard response that's already underway.
Thank you, Dr. Vanderhoff. Our final question for today is from Spencer Hickey with Hannah News.
Thank you. I wasn't sure if I was going to make the cut on that. Just to clarify, because I haven't been able to keep up with the federal announcement, these 20 medical personnel from the U.S. Air Force, is that the extent of the federal deployment at this time, or will there be more coming to locations that haven't been determined yet?
Well, the applications, this is a hospital by hospital application process that enjoys then strong support from Ohio's emergency management, the Ohio Department of Health, and other arms of Ohio state government. So this again is a targeted application process, and we've been working with hospitals who are interested, who believe themselves to be good candidates and want to go through the application process on submitting those applications. We're delighted to see that the Cleveland Clinic was recognized for that first deployment here in the state. But we'll continue working with hospitals, and we'll see what the FEMA determinations are as we proceed forward. But rest assured, Ohio is acting to address the needs here in Ohio through the National Guard and the Ohio Department of Health and other state resources to ensure Ohioans are able to get the care that they need. We're grateful for the additional support that we are now receiving targeted to the Cleveland Clinic. But we are also very proud of the response here in Ohio.
Thank you to our guests today. Dr. Vanderhoff, do you have any closing remarks?
Just want to again thank the guests who were with us here today. Want to recognize and thank our Guard members for their service and the real impact that they're having, and express my appreciation to the press corps for your continued attention to this really, really important issue.
Thank you. This concludes today's press conference. Thank you again for joining us.